This is your hospital being taken from you. Your hospital being taken from you. That's a big deal. Because when the hospital leaves, a hospital is an economic engine. It's not just the hospital. It's the jobs that come with the hospital. It's the suppliers that sell stuff to the hospital. It's the restaurants at which the workers of the hospital eat, right? It's the hospitals, the employees, the kids that go to the schools. It's so many other things. It's a cascading effect that occurs when the hospital closes. I just want you guys to understand that it's a huge impact if this hospital stays closed. What we've set up through crowdrise.com is an opportunity for anyone who wants to actually give to support the mayor's cause, okay? I can give you the information at the end, but the idea is if you want to give, the minimum you can give is $10, but the idea is that you can give to support the hospital whatever you are able to or willing to give, okay? Because this idea of development, this idea of continuously supporting your hospital is very important. And again, look at those numbers, $17.5 million being subtracted from your economy.
And so somebody from the outside has come and told you that your hospital won't work anymore. It's broke. Well, yeah, it's broke if you thought you were supposed to use it as an ATM and get millions of dollars out of it. It's broke. But that's not what a critical access hospital does. Now, we know money doesn't leak out like a faucet in a linear fashion, but every day that this hospital is not in your community, you lose $38,000 of economic impact, from $14 million to $17.5 million. Economic impact lost from this community because an outside big corporation told you that you couldn't have a hospital. But we believe differently. We have 3 sets of consultants that have now said that a CA, a critical access hospital, it will work here. We're the 3rd set of consultants. And the mayor got some good news from probably one of the most reputable institutions in this country that agreed with us, that said after a 5-year period, this hospital would be in the red about $400,000. In the black. $400,000. Well, that's where it's supposed to be. That big institution is Duke University. Now, it doesn't fit. This small community doesn't fit the model for Duke coming in here. This is not what they do. They run big, huge healthcare systems. That's not what we need here. And we're the 3rd set of consultants. RCHA said your hospital will work, and they had a model that shows you that you could have a new hospital and it will work. Poole Associates came in and told you that on top of your hospital, and not necessarily with a new one just yet, but using something new called the Accountable Care Organization is how this hospital can flourish as a critical access hospital. Not only can we stay in the black and break even and make some money, but hopefully we'll have a little money to pass on till next year. So how do we do that? This hospital has to be the right size. The federal government in the state of North Carolina gives you something called a certificate of need that says how big the hospital needs to be. This hospital does not need the number of beds that are allocated, around 50. This hospital needs about 10 beds. That's all. And with a 10-bed hospital, anybody here can figure out you don't need 129 people to run a 10-bed hospital. Now, granted, you go, well, there's going to be somebody's jobs that are going to be lost. Well, we understand that, but we need a hospital that fits the size that this community needs. That number is about 50 to 55 employees, FTEs, full-time equivalents. That's about what we need. So we want to get your hospital to the right size, to the right number of beds, so that it can flourish in this community. We want to budget appropriately for this hospital. We need funds to do anything, and we'll talk to you about how much the federal government infuses into your community. The Accountable Care Organization also has additional funds that it will infuse into your community. And we'll talk about how we'll budget appropriately so that we do not have some of the issues that the large out-of-town corporate folks who told you you couldn't have a hospital said it wouldn't work. Dr. Poole and I are under confidentiality agreements with Vita. We've seen their internal numbers. You don't need $500,000, $600,000, $700,000, $800,000 managers to run a hospital with 10 beds in it. Country folk, kitchen table math, figure that out. You need a PhD for that. We're going to budget appropriately. We're going to have the appropriate managers that will come and spend their time in your community. If you want to work and support the hospital here in Belhaven, you need to be here. You need to be a part of the community. Someone told me that the person that used to manage the hospital used to be here half a day a week. Half a day a week. I don't know what you can do in half a day a week, but it sure ain't run a hospital. Right. There are other things that your hospital can do. You don't have to just go to the hospital in Washington or go to Greenville. If you slip and fall and break your hip, you can spend some time recuperating right here at home. Your children, your family, your loved ones don't have to log up in the car and drive all the way to Greenville because you slipped and fell and broke your hip. We can recuperate you right here. Those are additional service line and business options where we can take care of you right here in Belhaven when we keep your hospital. So we have to get it to the right size. We have to budget appropriately. We have to spend money wisely. We have to bring care back to Belhaven. And we have to add service lines where the government incentivizes us to take care of people closest to home and at the lowest cost. That's how this plan is designed. It's designed very conservatively. Dr. Poole? So what is this? What we're looking at is 2015, 16, 17, and 18. And what these numbers are, this amount of money right here, I want you to think hard about this number. In 2015, the U.S. federal government expects to spend $45.4 million on residents of Beaufort and Hyde County, just for Medicare. Did you know that kind of money was associated with your community? The average Medicare recipient receives between $9,000 and $10,000 worth of care. We're only initially in the Accountable Care Organization accounting for 5,000 people. That's what we need, right? We need 5,000 for our ACO the first year. Those 5,000 folks are going to generate $45 million. The hospital only has a total budget of between $7 and $8 million. So where's this $45 million going? Well, see, big health systems like Vita need for you to be seen by Dr. Boyette and small doctors, and they need you to go fill up that big 400 or 500 bed hospital over there in Greenville. How many beds is it, Mr. Mayor? There's a lot. There's a lot. They need to see you here, but they need to send you over there. You can stay at home in your hospital with that $45.4 million. That money grows year after year. 45. The next year, we want 6,000 people from Beaufort and Hyde County just in Medicare. We want 6,000 people enrolled. 2017, we want 7,500 people. Those are very modest goals. By 2017, of the Medicare recipients in Beaufort and Hyde County, we want 7,500 people. The government expects to spend $72.6 million on those folks. Our budget in our hospital by that time will only be $9 to $10 million. We could almost have just a Medicare hospital. But gee, we get a free emergency room, and we get all the other stuff that goes with it, just looking at the Medicare monies. But here's the great part about an accountable care organization. Whether you like Obamacare or not, it's here. And trust me, it's here to stay, because they tried to repeal the thing 54 times. And it hadn't happened. So you, at some point, keep beating your head against the wall, you're going to realize this ain't going to change. So it's here to stay, so let's use it for the betterment of our community. Amen. So here's what the ACO does. In 2017, we got 7,500 folks signed up, $72 million. Let's say we take care of just some of those folks. And let's say it's $10 million that the government expects for the people we're taking care of. If we take care of those folks for $9 million, government cuts us a deal. They take the amount of money that we save and they're going to give us half. That's what Obamacare does. That's what an accountable care organization does. We take care of people because, see, this becomes your hospital. This is our hospital. You're concerned now because you know people are trying to take, not that they try to take your hospital away, they took your hospital away. It's gone. And so now you're going, well, now that it's our hospital, I have a vested interest. You know what? Maybe I should take those pills. And guess what? In the accountable care organization, it has doctors. The hospital is in it. Doctors are in it. Pharmacists are in it. Oh, who am I leaving out?
Church.
The church groups are in it. Pharmacy. All those folks are in the accountable care organization. And when we take care of those folks, because we'll have somebody come into your house. Miss Maddie, did you get all your medication? We know people who decide whether we're going to eat or whether we're going to take medicine. We're not going to do that anymore. We're going to make sure you get all of your medicine so that you stay well, so that when the government expects to pay $72 million and we use up 62, the government's going to cut us half of that money. In other areas, Mr. Bobbit has had great success in some of these programs. So whatever we save by taking care of one another in our hospital, we get to keep. And these are conservative projections. The government's already spending this kind of money on Beaufort and Hyde County residents just Medicare. Now, we're academics. So when you ask us anything, we're going to ask, what's the evidence? What's the citation for that? Where'd you get that from? Well, where we got our projections for the amount of money that we anticipate saving in the first year after the big corporate entity that took your hospital and left, after they're gone, the first year, we're going to take care of you better. And we're going to take care of you better, and the government will cut us a check. It'll be $908,000 difference. And we're going to get to keep half of it. Now, because this program is new, you don't get the money that first year. You get the money the next year. So the money we earned in 2015, we're going to get a check for that in 2016. And so you see these numbers rolling across. So we're going to save $908,000 because the average accountable care organization saved 2% of their revenues. That's what we projected. We got a citation, we have evidence for that. That's what's happening in the country. Lawyer Bobbit over here tells us that Belhaven and Beaufort and Hyde County are an ideal community for how an ACO is supposed to work. He believes it's going to generate way more shared savings than that.
That's correct.
Absolutely correct. So, but we've used the very conservative approach. First year, $908,000, we get that check in 2016. We get half of that. And this is what it looks like. Breaks even. By the time the current company leaves, we're going to lose some money. We're going to lose some money because there's a bunch of stuff to cover. There's a bunch of stuff to go in and figure out, is the stuff that's supposed to be in the hospital still there? There are people that have to be paid. There are benefits that have to be paid. There are things that have to be done that as the new Pungo District Hospital Board that's been established will have to take on the responsibility for those items. So this first year, there's money that has to be covered. And we know Mayor O'Neill is just all out. We had a meeting this morning, still working on, even after this hospital is closed, still working on funding streams for this hospital. But by 2015, we break even and we make a little money. But guess what? In 2016, we break even and make a little money, but we get that first check from the government when we take care of you better in the accountable care organization. And we add that to our bottom line, and all of a sudden we got $450,000 in the bank. So RCHA told you that you could get a new hospital and you could break even, and they showed that over a 5-year period. Our plan does not include a new hospital just yet. We're going to walk before we try to run a little bit. Our number is $464,000. The Duke University study, with all of their powerhouse over there, Duke said that that number would be $424,000. So if you don't believe me, believe Duke. Our numbers are very close together. LeJon and I were educated with some of the same folks that work over there. We count beans just like they do. Very close together. And year after year, what you see is a critical access hospital does what it's supposed to do. Stay in the community, take care of people, and break even and make a little money. This number you see right here, this bright yellow you see, this is the percentage of our revenue that we're going to be getting from shared savings in the ACO. So we're going to be in the black and stay in the black because the ACO, provided by Obamacare, provided by the Affordable Care Act, helps small rural critical access hospitals. This is what it does. Now, I want to tell you a political story very quickly that you may or may not believe, but sooner than later, Governor McCrory is going to get his arm twisted behind his back real hard by the folks who run rural hospitals just like Belhaven. And not just rural hospitals, what's going to happen, they're going to be pulling pretty tight, but then some of these big hospitals with 300-400 beds are going to start yanking on his arm too. We're taking care of a bunch of Medicaid residents, and you keep dropping the funding, and we can't keep paying for them. And at some point, Governor McCrory is going to say, you know what? We're going to expand Medicaid. He's going to have to. Otherwise, how are you going to take care of poor people? I grew up in the South in a deeply religious place, and I heard a book where a man said in that book that the poor will always be with you. They ain't going nowhere. They ain't going nowhere. This has to work. You can't let someone come and take your hospital. I grew up in a little town just like yours. We don't take kindly to that kind of thing. Now, we're very pleased to see this many folks caring and coming out about your hospital. The other day we had 3-4 folks here. But I think now you see it's real because it's closed. $38,000 every day. This has to work. $38,000, $14 million a year if you let them take your hospital. I've met and seen a lot of proud folk. Let's lift our heads together and keep our pride and keep our hospital. Thank you.